And today I'll be doing my oral medication administration exam. I'll wash my hands. I check for cuts, laceration, remove the jewelry. Okay, turn on the faucet. And water, cut in, out, slowly. So now I'm going to read off the physician's order that was emailed to me by Ms. Skeetwell. So the patient name is Mr. John Alfred Doe, date of birth the 11th of the 6th, 1949, weight 210 pounds, registration number 1169334, account number 22445, room/bed, number 10, the Waters Male Medical Ward 2, diagnosis, hypertension, DVT, and hyperlipidemia, attendant physician, T. Johnson. Okay, we go to the top. The diagnosis, like I said, is hypertension, DVT, and hyperlipidemia. He was admitted to the male medical ward 2. His condition is stable. The activity is bed rest. The diet is 2 grams of low sodium diet. Investigations, CBC, UNEs, HB, PT, PTT, INR, CXR, and HBALC. The IV fluids, D5W/normal, sodium chloride at 150 cc/HR. The meds are Lipitor 20 milligrams per oral once a day, Lipressa 50 milligrams per oral once a day, Zinacef 1 grams IV fluid every 8 hours, Clexine 40 milligrams subcutaneous twice a day, Zantac 75 milligrams IV twice a day, Demerol 25 milligrams IV every 4 hours by Dr. J. Jones Brown, and all of these were written the 10th of the 11th, 2020 at 8 a.m. Transcribing the physician's order onto the medical record sheet. This is the physician's order here. Registration number is ordered. Okay, so the two medications that I will be administering is Lipitor 20 milligrams per oral once a day, 10 a.m. and Lipressa 50 milligrams per oral once a day at 10 a.m. Transcribing the physician's order. Now I'm going to wash my hand and go introduce myself to my patient. Okay, now I'm going to clean the trolley in order to prepare for the medication. So I get one napkin, fold it into 4. Okay, I go over to my trolley, standing away, and I clean from one side, go down, flip it on the other side, clean, go over. Alright, now pull it on the other side. Okay. Clean, over, flip it one more time. Okay. I'm going to prepare all of my supplies onto the trolley. This here is my garbage bag. So that'll go right there. I'm going to introduce myself to my patient and let him know what I come to do. Good morning.
Good morning.
Good morning. What is your name?
John Doe.
Shonda. Okay, what is your date of birth?
11/06/1949.
Okay, I'm student nurse Antonia Miller and I'm here to administer your 10 a.m. oral drugs for today, okay? Can I see your ID band if you don't mind? You feeling okay?
Yeah.
Okay, that's good. So, that's John Alfredo Toe. Okay, that's correct. The 11/6/1949. Okay, that's correct. So I'll be right back to administer your medications, okay? Alright, thank you. My hands again because I touched my patient to check with the MER. Okay, so I've washed my hands. Now I'm going to get my medication and compare it to the physician's order. I'm going to make sure I do the 3 checks, also remembering the 5+5 rights of drug administration. So we have the right patient, the right medication, the right dosage, the right time, and the right route, okay? So this is my physician's order right here that was sent. Okay, it's a physician's order. This is the chart that the MER, the drug record that I transcribed. We're gonna come over here to the trolley that I already have prepared, and I have the patient name, Mr. John Alfredo Doe, his medical record number, date of birth, and the ward. So now I'm going to look for his medication, which are Lipressor and also Lipitor. So I open the drawer. Going to look. Okay, this is Lipitor. I'll do one at a time, okay? So this is Lipitor. I'm going to take this over here to compare with my physician's order. Okay, you can see. So, ward, male, medical 2. Patient name, John Alfredo Doe. Medication, Lipitor, 20 milligrams per oral once a day. And the doctor, right down here, Dr. J. Jones. And the expiry date, the 12/2022. Okay? So that's my first check. I'm going to come over here, and I don't have to do any calculations because the drug is already packaged as the correct amount. So what I'm going to do is open it using my spoon, not touching the medication. I'm going to take out 1 tablet. Okay, that's 1. I place it in there. That's Lipitor. Okay. So I go back over here to the physician's order and I compare it for my second check. That's male, medical ward 2. Patient name, John Alfredo Doe. Medication, Lipitor, 20 milligrams per oral once a day. The doctor, Dr. J. Jones Brown. Also the consulting doctor, D. Johnson. The expiry date, the 12/12/2022. Okay, that's correct. So I take this medication and I leave it here for when I go to my patient to do my final 3rd check. Okay, so the next medication that I have to administer is Lipressor. So back to the same patient drawer, open it. Okay, Lipressor. So we go over here to the physician's order and we compare. Male, the ward, male, medical 2, that's correct. The patient name, John Alfredo Doe, that's correct. The medication, Lipressor, 50 milligrams per oral once a day, that's correct. The doctor, D. Johnson, also Dr. J. Jones Brown. Expiry date, 12/12/2022. Okay, so I come over here again with this drug. I don't have to do any calculations because it came packaged in the correct amount per tablet. So I open it. Again, I do not touch the medication with my hands, or any medication that fall I do not pick up. So I take out 1 tablet, and I place it right in there. Okay, so I do my second check now. Come back over to the physician's order. The ward, male, medical 2. Patient name, John Alfredo Doe. Medication, low pressure, 50 milligrams per hour once a day. The doctor, D. Johnson. Also, J. Brown. And the expiry date is 12/12/2022. Okay, that's my second check. I leave this medication here. I compare my final check when I go over to my patient to administer these medications. Okay, so I will leave my drawer, just close it now. Hi, Mr. Doe, how are you? Okay, so I'm back to give you your medications. Okay, I provide privacy, ensuring that my patient has privacy. When I assessed his blood pressure, it was high, so I am going to administer the low pressure and the Lipitor. Okay, so Mr. Doe, you know your Lipitor is to lower your cholesterol. It is a statin drug in the drug classification. Some common side effects that you may have is diarrhea, stomach pains, and joint pains. Okay, your low pressure is to lower your blood pressure. It is beta blocking anti-hypertensive drug group. Some common side effects of it can be dizziness or you feel drowsy. Okay, so I'm going to administer it and I will do my final check. Okay, so with the low pressure, do my final check against the physician's order. Ward, male, medical 1. Patient name, John Alfred Doe. Medication, low pressure, 50 milligrams per hour once a day. Dr. D. Johnson, also Dr. J. Jones Brown. Okay, that's correct. My other medication, male, medical ward 2. Patient name, John Alfred Doe. Medication, Lipitor 20 milligrams per hour once a day. Dr. J. Jones Brown, Dr. D. Johnson. Expiry date to 12/12/2022. Okay, that's my final check. So now I will administer. Are you comfortable? You want to sit up? Okay. Can you raise up your tongue so I can ensure that you took your meds? Okay, sides. Okay, great. So he took his medication. Okay, so I will be back in 15 to 30 minutes to check on you to make sure that you're okay. If you need me before then, you can call me and now I'm going to document. Okay, wash my hands. So I have to wash my hands. Now I come to document. Okay, so I would have administered Lipitor at 10 a.m. So I put NSTDAM, nursing student A Miller, and I backslash to leave space for the RN to sign. Also the Lipressor, NSTD, nursing student A Miller, backslash, space for the RN to sign. Okay. Clean the trolley again, folded in 4. We go from one corner down, the other side, one corner down, fold it, one corner down, the other side down. Okay, so I discard this now, wash my hand, and go back to check on my patient. Okay. Okay, so now that I have cleaned up and documented, wash my hands, I'm going back to check on my patient as promised. So, Mr. Doe, hi, it's me, student nurse Miller again. Just come to check on you. How you feeling? You feeling okay? Any side effects? Would you like anything else? Want some water or anything? Okay, so you're good.
Yeah.
Okay, so I'll be at my desk in the front. If you need me, you can just call me or wave your hand. Okay? Thank you, Mr. Doe. You're welcome. Okay, so he's good, and this is exams.